has no specific structural cause, although there is some proportion of patients with known pathologies that can cause or maintain the pain, such as vertebral fracture, malignancy, infection, arthritis, and cauda equina syndrome. This table presents the association between MRI findings and low back pain. I presented this table to show that some MRI findings like disc degeneration, disc protrusion, and even spinal stenosis can be found in people without low back pain. Low back pain has a burden on several aspects like overall disability, social identity, and cost. If we take an example on the overall disability, in 2015 report, low back pain has been considered the sixth cause in terms of overall disability burden, as presented by DALI, the Disability Adjusted Life Year. And it is the first one, it is number one, a leading cause for years lived with disability. This burden has been increased since 1990 up to 54%. Low back pain can cause a loss of independence and social identity, hopelessness, family strain, social withdrawal, loss of job, and lack of money, and interestingly, inequality in wealth. In Australia, for example, by the age of 65, they found that the people who were retired early due to low back pain, their average median of wealth was only 5,000 Australian dollars, whereas people who remained at work, they earned more than 339,000 Australian dollars. There are no direct studies on the cost and the effect of low back pain on cost, especially in low and middle income countries. But generally speaking, low back pain has a high cost comparable to other conditions such as cardiovascular disease and cancer. In the UK in 2006, more than 400 out of 10,000 patients with low back pain consulted GPs. And in US in 1997, 44% of population used one or more than one alternative medicine for their low back pain. So it is really a burden. Briefly, these are the recent recommendations from clinical practice guidelines. I will talk about these details, inshallah, at 3 o'clock in my next presentation, hall 2, about the diagnosis and management, or let's say rehabilitation of patients with low back pain. So I'll leave that for the next presentation, inshallah. Although there are several recent clinical guidelines recommended similar recommendations, there's still a huge gap between the evidence and the practice. What I mean that a lot of therapists or clinicians, they highly use or overuse a low value care, or they may not use a high value care. So because of that, there is a need for action that will focus on avoiding harmful and useless treatments, addressing widespread misconceptions about low back pain in the public and even among health professionals. This is very important but more difficult, so we have to have a joint collaboration for policy, public health, healthcare practice, social services, and workplaces.